Hello, everyone, and welcome to Episode One of the American Society of Nephrology's Emergency Preparedness and Response podcast series. My name is Srinath Yadlapalli. I'm a nephrology fellow at Indiana University School of Medicine, Indianapolis, and I'm excited to be your host. Over the next two episodes, we'll describe how ASN became involved in emergency preparedness and response, discuss preparation for any emergency, delve into ASN's COVID-19 response, and describe unique features of natural disaster response for dialysis patients. Today, we are joined by two distinguished guests. First, we have Dr. Jeffrey Silberzweig, who is the Chief Medical Officer of the Rogozin Institute and Professor of Clinical Medicine at Weill Cornell Medical College. He's also the Chair of ASN's Emergency Partnership Initiative and co-chair of the Current and Emerging Threats Work Group. And next, we have Dr. Sarrah Johnson, Chief Diversity and Inclusion Officer and Senior Vice President of Operations at US Renal Care. Welcome to you all. Dr. Jeff, let's start with you. How did American Society of Nephrology, in short ASN, become involved in emergency preparedness and response? And what led to the formation of this group?
Thanks for having us here today, Srinath. This is a very exciting program that you've put together. In the aftermath of Hurricanes Irma and Maria, which struck the Caribbean and South Florida in September of 2017, ASN was asked to provide logistical support to kidney providers and to patients with kidney diseases, helping them to find dialysis centers that were open and find patients who were in need of care. Recognizing that there was a lack of coordination between government and private resources, ASN convened an organizational meeting in Washington, D.C. in June of 2018. And due to the certainty of future disasters and the enthusiasm of all gathered to work together, ASN formed the Emergency Partnership Initiative, which has now become known as the Emergency Preparedness and Response Program. Dr. Lurie agreed to serve as co-chair of that committee, bringing her expertise and experience from her role as the Assistant Secretary of Health for Preparedness and Response under President Obama and leading the U.S. response to Hurricane Sandy in New York. And I became co-chair with her of that response team.
Thank you, Dr. Jeff. That's a great overview of how the program got started. You mentioned that Emergency Partnership Initiative has now become the Emergency Preparedness and Response Program. What is Humanitarian Kidney Support Program and what role does it play?
Our Humanitarian Kidney Support Program is a coalition of professionals dedicated to supporting people with kidney disease and kidney health professionals following natural and man-made disasters and helping them prepare for those eventualities. Further, there's a work group aimed at identifying and helping to manage current and emerging threats, and work group aimed at helping to build a sustainable dialysis system with a strategic focus on climate impact. The HKSP and its three components, emergency preparedness and response, sustainability, and current and emerging threats, all work together closely with the KCVC, the Kidney Community Vaccine Collaborative.
Thank you, Dr. Jeff. That's a helpful overview. Now, let's talk about the team. Who is part of the Emergency Preparedness and Response team?
The Emergency Preparedness and Response team includes nephrologists, nephrology nurses, patient representatives, dialysis providers, and governmental agencies like the Kidney Community Emergency Response Coalition and the Centers for Disease Control and Prevention. There are also representatives from non-governmental organizations, including Direct Relief and Renal Dynamics. Each of these organizations has different roles and different priorities in the aftermath of an emergency. ASN also collaborates with international organizations like the European Renal Association and the International Society of Nephrology.
That gives us a great picture of the team. It really sounds like a well-coordinated effort. Sarah, I'd like to turn to you now for our next question. What was the role of emergency preparedness and response in Hurricanes Maria and Irma?
Thank you for having me here, Srinath. Both Hurricanes Irma and Maria had a devastating impact we know especially in Puerto Rico. The ASN helped inform the affected kidney community about the extent of the emergency and identify which dialysis centers were open and functioning. Beyond that, the team assisted in locating patients requiring care. ASN also communicated with nephrologists who were willing to travel to Puerto Rico to volunteer, and nephrologists in states like Florida who were able to care for patients arriving there from the affected Caribbean islands.
That's a great overview of the team's response to those hurricanes. Let's talk about a more recent hurricane response. What was so unique about Hurricane Helen?
What was unique about Hurricane Helene was its impact on the dialysis community. Because the Baxter plant, which provides a significant percentage of peritoneal dialysis fluid and IV fluid, was severely damaged. ASN's leadership recognized this issue and collaborated to author guidelines for preservation of peritoneal dialysis fluids while avoiding negative impact on patient outcomes and patient care.
Can you talk more about how ASN helped navigate the dialysis solution shortage during Hurricane Helen?
Hurricane Helene posed a unique challenge for the kidney community. However, leveraging the relationships that were built during the COVID-19 pandemic, ASN's policy team worked with the HKSP and with the chief medical officers of U.S. dialysis providers to respond to the shortage of peritoneal dialysis solutions in Helene's wake. In response to concerns that patients would not have sufficient supply of fluids for optimal treatment, a letter was authored to the FDA, who provided waivers for the importation of solutions so that patients could continue peritoneal dialysis at home safely.
That's a great example of how the relationships and infrastructure built during one crisis can be leveraged for another. And speaking of a larger crisis, COVID-19, Dr. Jeff, let's turn back to you now. What was the role of ASN in COVID-19 pandemic?
When COVID-19 hit the US in March of 2020, ASN recognized that there was likely going to be a risk to patients with kidney disease. And so ASN asked the leadership of the Emergency Partnership Initiative to join with the leadership of the Nephrologist Transforming Dialysis Safety Work Group to help guide the kidney community in its time of urgent need. We gathered experts in all areas of nephrology and formed four subcommittees: outpatient dialysis, home dialysis, acute or hospital-based kidney care, and kidney transplantation. Each work group consisted of both adult and pediatric nephrologists, nephrology nurses, social workers, mental health professionals, and kidney patients. Collectively, we produced dozens of webinars and podcasts, published dozens of peer-reviewed articles, and stood up multiple online modules. In addition to scientific analyses of prevention, diagnosis, and treatment of COVID-19, we explored a wide range of topics from personal wellness and safety to mental health and more.
That's a great and comprehensive overview of ASN's role. It's clear a lot of work went into it, but I imagine it wasn't so easy. What were the challenges faced by ASN during the COVID-19 pandemic?
I think you're right. It wasn't easy in any way, shape, or form for ASN or for anybody who was caring for patients during that period of time. In March of 2020, the kidney community was thrust into the forefront of COVID-19 pandemic when the first two reported deaths from COVID-19 were both dialysis patients living in the Seattle, Washington area. At that time, there was no playbook as to how to care for these patients or how to manage the risk of COVID-19 in a dialysis clinic. ASN quickly realized the kidney community needed information and began the work that we talked about in collaboration with the Centers for Disease Control and Prevention. Then in April of 2020, the kidney care community in the New York City metropolitan area experienced an unprecedented surge in the need for dialysis services for patients with acute kidney injury complicating COVID-19. Health systems became acutely concerned that they would not be able to treat all of the patients in need and voiced their concerns to the federal government, who turned to ASN and asked us to take the lead in quantifying the severity of the shortages. We convened nephrology leaders from the major medical centers around New York and collected data documenting the need for more dialysis supplies. After sharing that data with industry leaders, we were able to get them to steer additional supplies to the most severely affected centers and to ensure that all those in need of care received that care.
It sounds like a lot of what you were doing was reactive, trying to manage a crisis as it unfolded. As we moved into a new phase of the pandemic with development of vaccines, what role did ASN play in early distribution of COVID-19 vaccines to dialysis patients?
As you say, for all of us who were involved in the COVID-19 pandemic, we felt like we were learning to fly a plane while it was in midair. In terms of the COVID vaccines, as vaccines became available, we began advocating to make them available to kidney patients. Data had showed that kidney patients suffered more severe morbidity and mortality than the general population. So we worked with the CDC and dialysis leadership to create a distribution pipeline so that all patients could be vaccinated by dialysis providers in their medical homes. In January of 2021, the White House allocated vaccines to dialysis centers through a hub and spoke model to ensure that all patients had access to vaccines. In response to the distribution, vaccination rates among patients with kidney disease increased dramatically, and the relationships between kidney care providers and ASN were strengthened greatly.
Thank you, Dr. Jeff. The vaccine distribution effort is a great testament to a collaborative approach. It sounds like throughout the pandemic, a lot of different people and groups needed to be on the same page. Now, Sarrah, back to you. What else did ASN do to help organizations share information and learn from each other?
In addition to a lot of what Dr. Jeff had mentioned, the ASN helped gather chief medical officers on a weekly call to discuss COVID-19 response. This platform became a place where chief medical officers could share information and learn from each other. This group still meets monthly today and actually now includes chief nursing officers. It was, in fact, this group that significantly participated in the PD fluid shortage response that was previously discussed.
It's impressive that you were able to create such a vital communication channel. I'm curious, how was ASN able to mobilize and accomplish its goals?
The ASN formed the Emergency Partnership Initiative, or EPI, and then leveraged the power of partnerships to mobilize resources and accomplish its goals. This collaboration with various organizations and nephrologists was key to the success of the initiative.
That's an excellent look at how ASN accomplished its goals. Now, where can our listeners find more information and resources provided by ASN?
That's a great question, Srinath. Listeners should know that the ASN has recently published a learning module called Emergency Preparedness for Dialysis Providers and People Living with Kidney Disease. This is an all-inclusive module. It provides not only general information, but specific information depending on the type of emergency. For example, there is a section on hurricanes, tornadoes, and others. The module can be accessed on ASN's Excellence in Patient Care website.
The module sounds like an essential tool for anyone in the kidney care community. This concludes the first episode in Emergency Preparedness and Response series. Many thanks to Dr. Jeff and Dr. Sarrah Johnson for sharing their knowledge and expertise. In the next episode, we will discuss important information on emergency preparedness for medical directors, dialysis unit, clinical and operational staff, and kidney patients.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.